colleagues Josh, Parajita and Sharla. Emma's got some slides for us, and she's going to be leading the rest of the meeting. We'll have some breakout groups and stuff as well as we go on, and then we'll be coming back together about 4:25 for a wrap up. Okay, Emma, I'm going to hand on to you. Thank you.
Thanks, Camilla. Hi, everyone. So I'm Emma. So I'm a project manager from the Leeds Healthcare Academy. And we're going to be talking today about workforce wellbeing. So I've just done a few slides. We'll try not to give you overkill by PowerPoint, but yeah, so we'll be interactive. And if you've got any questions, like Camilla said, just put them in the chat and we'll try and answer them along the way. So it's all about wellbeing and yourselves today, focusing on what wellbeing is and trying to support you and your colleagues. So we know that wellbeing at the moment is more crucial than ever. Obviously, everyone's feeling like the stretch. There's the capacity issues. Everyone's feeling a bit overwhelmed. So we just wanted to share what's available to you that you and your teams can access. So hopefully you'll get a lot out of today. And if there is anything that you want to follow up on afterwards, we can share our details. You can catch up with us afterwards and ask any questions. So I'm just going to share a bit about who the Leeds Healthcare Academy are. I don't know if some people have already heard of us and what we do. And then we'll be sharing some of the wellbeing offers that are available. There's training and support available. And then we're going to talk about a new programme of work called the Thrive at Work programme, which you may already have heard of. And then Josh is going to talk about some of the learning and development opportunities that are available for everyone here. So firstly, I'll just talk a bit about the Leeds Healthcare Academy. Apologies that it's a bit of a messy slide, but it just gives a bit of an overview of who we are. So the Academy exists to integrate and better support employees and organisations working across the Leeds health and care system in Leeds. So it does span health, social care, third sector, independent sector and education providers, which I guess is why we wanted to come here to the local care partnership meeting, because there is a range of different organisations here. So the Academy was created to support a joined up approach to workforce planning, development, learning and culture, education and learning. So it's across all health and care partners. So as you can see on the slide, the work is structured across 4 different pillars. So I work in the workforce innovation projects sort of pillar. Josh works in the education and learning sort of area in terms of training and development. And then we have 2 other sort of areas in terms of strategy, planning, research and evaluation, and then leadership and culture as well. So we'll be talking about some of these offers under here, some of these projects as we go along. So on the next slide, I've tried to sort of give an overview of what is available that we're aware of from a wellbeing point of view. Now, there may be other things that we're not aware of, so it's just a caveat that these are just some of the things that we're aware of. And we know that at the moment, like I said, everyone's wellbeing, we need people to be sort of thriving at work, to help with better care, better retention, better system outcomes. So it's important, obviously, for everyone to feel well at work, basically. So if you do know of any offers that we haven't included, obviously, please let us know. These are just a snapshot of what we're aware of and what's free within the system. So on the top left-hand corner, we've got the Leeds Recovery College, which I'm hoping most of you will have heard of. So they're within the LYPFT, and they have some amazing free offers in terms of wellbeing courses. So they have 1-day wellbeing retreats, 1-hour sound baths and relaxation courses, 2-day wrap wellness recovery action planning workshops, and free yoga classes as well. So I've been on a sound relaxation course, and it was really useful just to take an hour out of your day to get that well-being into the day, and it is all free, like I said, and a lot of people aren't aware that everyone within this meeting, I guess, can access it. I've also put Leeds City Council. They have a lot of free training from, I think, wellbeing training as well as leadership and management training as well. Again, I put the link on the slide so you'll be able to access that. I also know that Voluntary Action Leeds and Inspire North have some great training as well, which everyone has access to. So again, it's just being aware of what's out there and what's available for you and your teams. Next, I put about resources and support that's available. So obviously, I'm assuming that you've probably heard of Mindwell. It's got some amazing resources on there. It's got access to lots of different things that can signpost to people. I've put the Padlet. We've got a health and wellbeing Padlet, which again is a great signposting tool and great tool to access lots of different wellbeing offers. I also put about the West Yorkshire Health and Wellbeing Hub. Again, it's got free access to therapy, counselling, specialist counselling and therapy. So hopefully you may know about that. And lastly, on the resources and support, I put about a free coaching offer. So anyone within, again, working in health and care within West Yorkshire can access a free coaching offer. So I've accessed this myself. You can access a coach within a couple of hours, basically, and you can start having coaching. I don't think there's any limit on how many times you can access the service. So again, it's just worth knowing that if people within your organisation are looking for a coach or they need some kind of support, that's available as well. And then lastly, I put about benefits as well, which I guess isn't really wellbeing-y, but I guess it's just making and highlighting what's free within the system. So I don't know if people are aware of Tickets for Good, where you can get it's really like almost free tickets basically for theatre, festivals, music events. So it's available to anyone working in health and social care. And the blue light card, again, there's loads of discounts available to anyone. And it's just, we've also got a benefits page on our webpage, which has different benefits as well as available to people working in health and care. So I'm hoping that most of these on here you may already know about, but it was just to raise them, because when I speak to people, they may not know about the Leeds Recovery College courses that are free. They may not know about Tickets for Good. So I'm always trying to highlight what people can access. So moving on to the Leeds Healthcare Academy offers and what's available within the academy. So the Leeds Health and Care learning portals in the top left-hand corner. So we've got a learning management system which has access to over 100 courses, different types of training from e-learning to face-to-face courses. Again, it's free to you and to anyone within your organisations to access. So some of these courses are like building trust, building resilience, developing emotional intelligence, mental health in the workplace, cultural awareness in the workplace, menopause at work. So there's so many different types of wellbeing courses that are available to access. All you have to do is just log on, go in, log in your details, and then you can access all of these courses. So again, I've put the link on this page here. Moving on to the middle, Springboard. So Springboard is a personal development program for women. It's a 12-week program to work on a variety of different topics, such as maybe confidence, assertiveness, career planning. I've been on it myself a couple of years ago. It was really beneficial. I've met loads of different people from lots of different sectors. So yeah, it's well worth sharing within your organisations or if yourselves are interested. So they're running 2 cohorts in the autumn, and the closing date for anyone that's interested is the end of July. So again, I can share the links on the slides afterwards, but yeah, it's just worth looking at. On the top right-hand corner, we've got the Leeds Health and Care Talent Hub, which you may have heard of again, but it's a citywide service to support people within Leeds into jobs, volunteering, training and work experience. So the service can also support organisations with vacancies in terms of screening, interviewing, so you can find local talent from local communities. So we know that although it's not a wellbeing offer as such, we know that yourselves may be recruiting and you're probably quite fairly stretched in terms of capacity. So that service is there to help you if you need help with pre-screening or anything like that. So it's just to make you aware that it's available. So they do value-based recruitment and offer a personalised approach to recruitment. So it's not just finding people that are not looking to work in health and care. They're actually finding people and supporting them into health and care roles. And lastly on this slide, the Career Compass Leeds, which is a fairly new tool, but it's specifically looking and supporting people at finding roles within the health and care sector and what might be the right career for them with the health and care sector. Because we know that there's lots of different jobs, there's lots of different places that people can go into. So my colleague Josh and the team have been going into schools and colleges talking about the Career Compass Leeds and how it can help people, and particularly young people, I guess, to find what might be a good career for them, where they might want to go within health and care. Obviously, we know there's a typical jobs in a medical sort of setting, but there's other jobs as well within the third sector, within social care. So it's just trying to highlight the different kind of areas. So again, it's not really a wellbeing sort of tool at the moment. It is sort of being developed with a new bit of funding, the Career Compass, in terms of looking potentially at people's health and coaching them to see what might be the right role for me based on my health needs and my preferences. At the moment, it's currently being developed along those lines to look more at what a health coaching model might be. And then lastly, I'll move on to the new programme, which is the Thrive at Work Hub, which again, you may not have heard of because it's only been around for a couple of weeks. So the Thrive at Work is a 12-month government funded project until next March. Like I said, it's only been going for a couple of weeks so far. So it's open to anyone working in the health and care system, and its key focus is primarily on workforce wellbeing and keeping people well at work. So the key objectives are around preventing people leaving work due to ill health and supporting people who are already potentially absent due to their health to come back to work. So I've just put a link, obviously, to the website that's on here. And if people did want to refer, there's a self-referral route for anyone that thinks they need the support, or a manager and a health professional can refer into the hub as well. So just moving on. So this is how the delivery is working at the moment. So people would self-refer, or a manager would refer into the Thrive at Work Hub, and they would have maybe a 15-20 minute conversation with someone working in the Thrive at Work Hub, just talking about how they're feeling at the moment and what support they might need, and just answering some health questions. And then we would refer on to one of these 3 services, which we're just going to talk through in a minute. So the first service is a mental health fast track service provided by VivUp, who you may have heard of, or you may not have heard of, but they offer a fast track counselling service, but specialist counselling. So it might be CBT, it might be trauma informed counselling, it might be EMDR therapy. So there's a variety of different therapies depending on the person and what they need. There's no kind of limit on maybe how many sessions someone needs. It's depending on what the person needs. So it is a really personalised approach to wellbeing. The next service that we offer is a workplace adjustment service offered by Leeds Teaching Hospitals. And this is working, so the occupational therapist is leading this service, and they work as a 3-way conversation between the employee, the OT and the manager. So it's talking about what adjustments could be made within a workplace to support somebody to stay well at work. And it's almost meant to be above and beyond maybe what reasonable adjustments you might find within an occupational therapy report. So it's proven really popular because I guess, yeah, it's just looking outside of the box really at what adjustments could be made within a workplace. So the occupational therapist is actually running some sessions to talk about what the service looks like with managers. So those are becoming really popular at the moment. So there's one this week on Thursday, which a lot of managers are going to, just to find out a bit more about the service and what's involved with it. So the last service that we're referring on to at the moment is the integrated coaching service. So I just wanted to bring in Charlotte and Gita at this point, because they're the ones leading and running the service, just to talk a bit about what that looks like and how it's going for them at the moment.
Brilliant. Thank you, Emma. Thank you, Emma. Yeah, so my name's Charlotte Nolan, and I am the new project manager for the service. And I've got my colleague here, Gita, as well, who is the team leader. So we're just going to talk a little bit about the integrated coaching service part of the delivery of the model here, just to give you a bit more of an understanding of what it is as the service that we offer. So if you can go to the next slide, please, Emma. Brilliant, perfect. So within the integrated coaching service part of the Thrive at Work programme, it's delivered by Inspire North, but within that we've recruited staff members that work from a range of different organisations like Barker, Feel Good Factor, Leeds Mind. So within that we bring a lot of different pathways and a lot of different knowledge, skills and experience to be able to support professionals who may be at risk of becoming off sick from work, or who are currently off sick from work, to again support them in aid of getting back to where they want to be at. So the element of support kind of works with the coaching, and with that we look at one-to-one support, help people to build their confidence and kind of look at those realistic steps to help them move forward. There's also an element of practical advice and guidance which is tailored for people as well. So if someone has a particular need or needs a particular type of support, we can help them to kind of navigate the different options and access the right support that's for them at that point in time as well. Another key part of the service that we're delivering is social prescribing. So I know it's kind of a buzzword and a lot of people know what social prescribing is about, but no one really thinks about it in relation to professionals as well, because we spend a lot of our time at work, probably more time than we should do, more time outside of our working hours. So it's kind of linking into different services that are within the community that we can think about, okay, is there something that I can do outside of work, and really bringing those resources and support networks towards you as well. And then lastly, individuals are also supported with goal setting and action planning. So we're really thinking about creating a personalised wellbeing plan that feels achievable for the person and feels kind of meaningful to them, because it's that rounded offer that we want to be able to offer professionals to get them back into control, to give them an element of control and to help them to feel more empowered so that both their health and their work is aligning to be able to be successful within their post. I'll just hand over to Gita now. Thank you.
Hi there, guys. Sorry, I don't know why my camera is still not working, so I'm really sorry for that. I'm very much new in the post. Like Sharla, we just joined last week. Last week was our first, Monday was our first day at work. So we are still trying to get around with things and stuff. So yeah, so next slide, please, Emma, if we can. So yeah, so what Emma wanted us to do, like I said, we are very much new into the project. I'm still trying to get my head around it. But some of the questions or curiosity that Emma had raised that through the work that our some of the work coaches has already started working in this project since April. And what have they faced in terms of like dealing with professionals who are currently probably at off sick or like not at work, and how can we bring them back at work and look after their ensure their well-being at work. So some of the things that have been raised were like, what are the benefits that maybe through the cases so far that we have witnessed, or any positive reflections, anything surprising that we could have noticed so far. So basically what I have done is like, I've spoken to the work coach who's doing the work for a month now, and she had given this inputs. So it's not my work really, but it's hers, which I'm bringing it here. It's basically, around curiosity and awareness around people. Obviously, it's a very new project, so we are still setting up. It's too early to say that, oh, this is working well or this is not working well. That's outcome measure. We'll obviously measure later on down the project. But the long-term benefits, again, are yet to be seen. In terms of short-term benefits, what we have noticed so far is like people are, or professionals are engaging very proactively. Lots of self-referrals have been like already come through the hub through Emma. And then again, what they have said is like, it's a very neutral space where they're able to share anything relating to workplace, any challenges that they're facing in workplace. It's a neutral ground where they are obviously sharing things with the work coaches. So we feel, okay, that maybe something is working because they're opening up. And again, what they have said, some of them is like, it's appreciative. They're very appreciative that they're like, the coaches are like a fresh pair of eyes or another professional who is looking at the situation from a different angle. So probably they can again guide them and coach them that what is working, what is not working for them, and how can they like motivate them and coach them to get back to work safely. And anything surprising, again, what we have seen so far is like bulk of the referrals are more around coaching. So what the work coaches have said is like, it's more than the social prescribing side of things. What we are seeing is like a little bit of light touch, even like getting them back to work and trying to motivate them that, okay, these are the barriers, what you're facing in terms of your health, how can we get you back to work safely? And lots of the referrals are again self-referrals, and those self-referrals again, what they have like in terms of light touches, they've said is like, we want to be a better versions of ourselves. So sometimes we are again wondering, are those referrals the right referrals for us? So it's basically again still the trial and error approach. What we are like literally trialing and seeing that, okay, some of the cohorts maybe it fits into, and some of the cohort of professionals, they're still testing it and seeing whether this is the right service for them or not. So yeah, like I said, we're still very, very early days. Thank you.
Oh, thank you, Gita, and thank you, Sharla. So we just wanted to take a bit of a pause and just see and ask anyone for feedback at the moment in terms of those offers that we've already talked about, in terms of the Thrive at Work programme. Were you aware of those? Were you surprised by any of those? I guess it was just to talk through if anyone had any questions about any of the things we've raised so far. I haven't looked at the chat yet, Rachel, sorry, but yeah.
So there's a question in the chat about volunteers and about whether they're able to access or whether it's just for paid staff.
So the Thrive at Work programme is just for people that are employed within the health and care system. However, the other ones, the other sort of training offers and benefits are available to volunteers. Rachel?
Oh, thanks, Emma. Like, really great to hear about all of that stuff going on. It was just to reflect, I heard you mention sort of the cultural awareness training. That's something that we've talked about sort of here in Hatch LCP. So it'll be really interesting to hear a little bit more about that. I know it's maybe in development. But yeah, maybe something that we would definitely want to opt into as partners within this area.
Yeah, I know there's cultural awareness training being developed. At the moment, I went to the migration steering board the other week, and they were talking about it there. There's also a project called Health Equity starting within the academy as well. So there's also some training on inequalities being developed as well there. So there is different pockets of training on that being developed, I think, at the moment. But does anyone think like the offers could help you or someone in your teams? Like, would you be able to, do you already share these offers with people within your organisations?
No, I totally don't share them. I didn't know that most of those were available, so I'm absolutely delighted to hear about them. I can already think of at least one person that would be that would really benefit from some of the services that you've mentioned. I'm only concerned that you're going to get overloaded really quickly.
So with the Thrive at Work programme, we've probably had about 100 referrals so far, but we are looking to reach those people that are really in need of the service. Obviously, if it goes well, hopefully the government will continue to fund the project moving forward. Obviously, it is only a 12-month funded project, but if the impact's there and people need these services, then hopefully it will continue.
Thank you. And Councillor Monarca's got a question.
Thank you, and thanks for the for the work that you guys are doing and for the presentation. I think I am thinking in terms, a lot of what you said is this is available for those that work in the healthcare system. And I think I'm wondering, and correct me if I'm wrong, whether is this also available, say for example, to people that work in, say, housing, and they are employed by Leeds City Council under housing. Obviously, they deal with a lot of customers and issues and stress and all that. I'm just thinking, I'm just wondering, I might be wrong, possibly. Oh, Peter, thank you. Thanks for actually, Peter's just raised his hand. Okay. Thank you anyway, Peter.
Peter?
Yeah, thanks. I mean, I think it's a good question whether people who are employed by Leeds City Council are eligible for this sort of thing. But I guess my assumption is the answer would be no, because we've already got a wellbeing offer, which includes VivUp and a number of other things. So I'm guessing that we wouldn't be entitled to access this because there's already, as a council, a number of wellbeing initiatives in place. So that would be my assumption.
If I may come in, sorry, I was just thinking they have some of the best in terms of, the therapies that she spoke about. And I thought, wow, that was really lovely, to have that. But I don't know what you guys have, Peter, but I thought that is really nice. You know, the very first slide of, you know, what's available. That was really great. And it would be, I don't know what we have. Leeds City Council for the employees, really, which it's good. Thank you.
I can double check about housing, but I think it would apply because you're still working in the health and care system, is my understanding. But I will double check that.
Okay, would be great. Thank you.
So I'm just going to move on to the next section. Josh, Josh works within the academy as well, so he was going to lead the next bit about learning development offers within the academy.
Thanks, Emma. I have got a bit of a croaky throat, so if I suddenly go quiet, then if someone can just fill in for me for a minute or two, if I'm coughing, then thank you. It's always a bit of a risk once you start talking. So I'm just thinking. I think I'm going to reverse what I was going to do. Actually, let's be brave, and I can tell you about some of the offers maybe after this little bit. So if it's okay with the person who may be putting us in some breakout rooms, let's do that now. And what I'd like us to do is go in some breakout rooms in maybe threes, and I'd like you to think about what matters to you in your conversations. So, you know, all the conversations you have that in a day, whether that's with the people of Leeds, you know, patients, customers, whether that's with colleagues, what are those things that are important to you to be present within those interactions and conversations? We'll do it maybe for around 7 or 8 minutes in our small groups. If you get to the point of being able to think about, okay, when these things are present, how does it support a good outcome? But equally, maybe when something's missing, what effect do you feel that may have on some of your interactions as well? Okay, and then we'll come back together and just see a few highlights. Does that sound okay to everyone? And yeah, if there's any questions, please pop it in the chat or anything like that. But yeah, what matters to you? What's important to you in your conversations? And then we will come back together. So I don't know who is controlling the
that's me, Josh. Yeah,
right.
so
Ruth,
I'm just
excellent.
creating the breakout rooms, and you said roughly 7 minutes, didn't you? So
yeah, let's go for that. And then I'll introduce myself properly because I forgot that I didn't do that either. So, you know, hey ho, we'll do it all in reverse.
Cool. Everyone should be moving into their breakout rooms now.
Thanks, Ruth.
Your headphones in. Yeah, it don't work.
Was that
it's
7
working.
minutes?
It's working now. Oh, that's good.
It's great, isn't it? You know, if you're slightly mid conversation, come back in the room.
My mic broke throughout the whole thing, and I'm trying to fix it, and then now it works. I'm so sorry.
It's been problem solving the whole time, and then back in the big space. Brilliant. Hopefully everybody has made it back and no one's lost in the Matrix. So yeah, 7 minutes there. It might have felt a short period of time. Might have felt a longer period of time, but hopefully you had a good chat and some things came up. It'd be really good just to hear any highlights. What came out? You know, was there anything surprising, anything different? What was it that came out for you in terms of what matters? And please just come off, raise your hand or come off mute, shout out, whatever works.
For staff to know that they're valued and listened to, I think, is a big thing. Communication's a really, really big thing. When you're managing teams, you're managing individuals, and act upon the concerns as well. Because I think if you don't act, on anything what they've brought up. They're not going to come to you again. They're not going to trust you. They're going to think, oh, well, they didn't act upon it before. And then that can cause, you know, a lot of negativity between your working relationship. So I think it's about listening and making sure that you're understanding what they're saying, you know, and acting upon anything really, and just getting to know that individual as a person, not just all about work related things, but get to know the children's names, you know, are the carers, do they live in Leeds, is it, you know, do you travel far, you know, to come into work, and just to get to know them as an individual person, you know, rather than just a work colleague.
Yeah, love that, Sheree. Yeah, thanks for sharing some really nice stuff in there, you know, being heard, valued. And I love that bit you said around acting on things, and it's not just going through the motions, is it? You know, I'm not just sitting here going through the motion. I'm actually going to act where I can with what I'm hearing from you. And yeah, that lovely kind of warm element of, you know, just that a bit more human rather than we're at work and
Yeah.
we're all robots just
Yeah.
going about our business. Actually, we're people, aren't we? And
We
we've
are.
got things going on in our, you know, home lives and other places that we manage. And yeah, it's absolutely important to acknowledge that, and where we can give these mini little spaces for those chats to do. So yeah, love that, Sheree. Yeah, thank you.
You're welcome.
Charla?
No, I just wanted to add that we were kind of speaking about the true value that it adds for staff member, and councillor just got cut off at the end of the meeting there, but was making a really good point about that value in the different staff members, and you know, even us in managers and leadership roles, how we can be really stretched. So having access to services like these to really give staff an opportunity to have access to resources and support to help them to stay within work, to help people, because ultimately that's what it comes down to help people, is to utilize the resources and support to help themselves so that they can better help people as well.
Yeah, yeah, love that point. Yeah, so you know, we need to have some kind of fuel in the tank to be able to help people. If you know we are kind of running on empty, then that's obviously, you know, not great for us, but obviously in terms of other people as well, it's going to have an impact on them. So it's not easy, you know, the reality of the world and the worlds that we work in. So I think it's important to say it's around being realistic as well with you know, what your world is like, what your day to day is like, but equally, where are those opportunities to add in to the tank, so to speak, or have these, you know, conversations and chats. Rachel?
Oh, thanks, Josh. We had a really good discussion. I think there's something about sort of joint responsibility of the different parties coming to the conversation in terms of like bringing about a positive outcome, and then also like joint responsibility for what might be the follow-up steps, perhaps afterwards, to sort of to take action. But something about being really prepared when you're going into a conversation, so that you've got all the information like to positively signpost someone.
Yeah. So you've got there's a bit of knowledge there as well, that, you know, you can think, actually I can offer something to help, and that preparation being key. I think it's really good point. Really good point. Brill. Okay. Emma, if you could just share the slide again, please, if possible. There's just a bit of a finish to this question, I suppose. Thank you. So, I know we're thinking about ourselves and colleagues at this moment in time, but this next slide, I think, really does play into to that as well. So we asked the same question. So we've been working on better conversations in Leeds, which is a whole city approach to real kind of personalised conversations with the people of Leeds. So, you know, thinking what matters to them and how we get the best outcomes for everyone. And so one of the questions that we asked was this question: what matters to you when accessing health and care? Okay, so just wanted to share the kind of top 5 answers that we've kind of rounded together. And I think what's nice to notice is, do they feel different to what maybe came up in your discussions, or actually are they really similar? So yeah, number 5 was helpful information. So people, important for people was getting that helpful information, and I think the key bit there is the word helpful. How do we know what is helpful for that person sat with us right there and then? And how do we find that out? And it's not just that, blanket approach or one size fits all. So it's that real personalised approach to that. Coming in at number 4 was understanding, and I know that came up in the group that I was just in. So being on the same page and walking away, each person walking away with that same understanding, and there's some kind of common ground there. I think when that doesn't happen, that's where you may come back together and think actually something different has happened here to what I was expecting. So again, just be mindful of how you get that understanding and how you check in that we are on the same page as well with that. Number 3 was building relationships. So unsurprisingly, really thinking about those strong relationships and that rapport that we can build. Sometimes we need to do that in a short period of time. So what's helpful when we haven't got much time, but a bit like we were just discussing there, where we can dig a bit deeper, ask some nice questions, get to know people. Certainly when we think about colleagues, all real helps to build that picture for each other. Number 2, staying engaged, and this is a tough one, I think, actually, sometimes, because I mean, look at now, we're coming up to 4 o'clock. So how engaged are we all? We'll all be probably feeling a little bit different. I know it's not my optimum time of staying engaged as the day passes. So I think it's around recognizing, are there better times for doing certain things, and finding out when's the best time to maybe have a conversation or do a piece of work with somebody. So being present in that moment for that person, bearing in mind you will have a lot of stuff. You may have had 50 conversations already up to press. You might have a lot of stuff going on, work-wise or home life as well. So for you, how do you stay engaged? What do you need? What's helpful for that? Do you get any mini moments throughout the day to take a breather, slow down, and get a bit of headspace as well? Okay. Very unsurprisingly, number 1, what the majority of around 1,000 people said was, what matters is being listened to. And, I'm sure we can all relate to that, where, if you feel that person's listening and you're getting, feeling valued and understood, what difference that can make. And I think that just highlights how important giving people some space to talk is and can be. And sometimes we maybe underplay it or maybe don't appreciate it as much as we should do, in terms of, it's amazing what can come out just by listening, and the different levels of listening where we can be empathic and things as well. So yeah, they're the top 5. So those what we got from the people of Leeds, but I think it fits absolutely with what we've heard and what we see with colleagues as well. So Emma, could you just flick on to the next slide, please? So just to round this off, really, those top 4, what we just saw, are actually your human qualities and that communication that we experience. Okay, and then that 5th one was that knowledge, experience, and the information. Bit like Rachel was alluding to and saying there, that stuff, that information that may support somebody, and having that prepped if where possible, or the knowledge, just having that knowledge there. But actually, how messages and information are exchanged through your human qualities and that communication being the key driver to positive interactions, communication as well. You know, this will look differently depending on who you talk to. So it's a two-way street. You know, it'll feel different depending on that person who's bringing maybe something to you, or equally if you're going to someone. And yeah, what's present within those human qualities, or maybe what's not quite there. Sometimes it may be that rapport that's not quite there. But yeah, just a really kind of relatively quick, simple thing to do in terms of actually what matters to you and finding out what does matter to the other person, and do you know actually what matters in that conversation, but for that person in life, in you know, in their current kind of situation as well. Okay. Emma, just thinking, yeah, is there anything, the poster, is that on here or not?
No.
Just wondering. No, that's fine. So, yeah, so in terms of my role, so I work alongside Emma in the academy, and we run a number of kind of sessions around better conversations or communication training sessions. The majority are face to face. There's an e-learning session, then there's kind of more bite-sized 3-hour workshops that we do, and then there's some of my colleagues run an introduction to coaching 1-day course. There's the motivational interviewing course that we do, which is a 2-day course, and then we've just recently trialed an introduction to facilitation skills 1-day training session. So that's really for anyone who may be involved in facilitating meetings, or you know, and that could be with the public or with colleagues who may be looking at increasing confidence or skills around yeah, you know, those group and facilitation skills. So that seemed to go well, so we're going to be running another 2 sessions later in the year for those. You can access all of those on the learning portal that Emma mentioned earlier, and I think we've tried to, I think, cater for a range of experience within that. So, you know, you maybe someone coming in with not tons of experience around communication training, but all the way up to, you know, building up in terms of the coaching and looking at models and stuff as well. I think what is important to say is these days are for you, and for you to, you know, get a bit of breathing space to consider some of this stuff. We don't often get to look at or reflect on our interactions, communication. So it is really about trying to create that space with other colleagues from across the health and care sector. So some really good shared learning as well that can come out of it. But yeah, it's really important. I think it's for you, and some space for you to reflect on how's it working for you, potentially how might it work for other people as well. Ruth.
Yeah, I just wanted to say that a few people from Hatch Local Care Partnership went on the Introduction to Facilitation training, as well as a few other people from other LCPs who want to start kind of leading on subgroups that come out of the LCP, and for people in this LCP, it was people who are going to be delivering the Food is Everyone's Business training. And yeah, they said they got a lot out of the day actually. So yeah, if any of you are thinking about wanting to lead within the LCP in whatever way that looks like, that might be, or that or another course might be a really great way of getting those skills started, because that's what a couple of people have already done and really loved it.
Oh, thanks, Ruth. Yeah, it's I mean, it's always best to hear from other people. That word of mouth is better than, yeah, me or anyone trying to explain it. And I've noticed there's a few colleagues that have done the smoking cessation training as well, and the core principles of better conversations are embedded in that too. So it is around there. My one last shameless plug, I think, of another piece of work that I'm involved with that I think has got strong relevance to this LCP in particular, is the children and young people work that we do in the academy, and it's really looking to inspire, broaden horizons of children and young people within the most deprived communities of Leeds, and really to look at roles in health and care, but just in general, raising aspirations. I know I've had conversations before with Ruth and Rachel around this, but we've been working with primary schools and secondary schools within Hatch, and I think what would be great to link in even further. We've done stuff around the food is everyone's business, around taking some of these messages home to families and connecting them in. But my ask, or to maybe for yourselves or to take away for your teams, is if anyone wants to get on board in terms of coming into schools and looking to inspire children, young people around your stories or the work that you do, then please do give us a shout. It's an exciting piece of work as well. But other than that, I think I am just about done. Please do just give us a shout if there's any further questions at any point as well. But thank you.
Thanks, Josh. You're handing back to me.
I think I'm handing back to you, Camilla. Yeah, Emma,
Yeah.
we're signing off on that one.
I'm going to send some of my stuff on that conversations training, Josh. I think it's really important for people to have time. I'm assuming it's online, but I was just, is that right?
There's some online, Camilla, but there's some face-to-face as well.
Yeah.
So it's a mixture.
Yeah. I was just talking with one of my staff members last week who was regretting that one of her courses that she's having to do at the moment was online. But we identified that the reason was not because it was online per se, but it was because online and not done particularly well. So doing things like setting up breakout groups so that you can connect with other people on the training and being interactive on the chat and all that sort of thing do make the online training experience better. Personally, I don't think it's quite as good as face-to-face, but it's definitely a lot better than just being talked at with a slide pad for a day, which is what she seemed to be getting. So it's great to see you giving us an exemplar there of how you can be done in a really engaging way. Thank you. So, well, thanks to Joshua and colleagues from the Academy for the session today. We're running a bit ahead of time, so I'll bring the meeting to a close a little bit earlier. If there's anybody that would like to spend a few more minutes giving a bit of an update about their group, very happy to hear that. Before we end the meeting, just stick your hand up. While I'm waiting for people to think about that, just a reminder that our next meeting is on the 15th of July. So watch out for more details coming soon. We won't be having a meeting in August because it's summer and lots of people away and stuff. So we'll reconvene after that in September. Susan has got her hand up.
Hi, just a plug for my community gardening course. It happens at Knowlmount Community Centre on a Monday morning. It's either self-referral or feel free to kind of contact me. I know people are quite nervous about coming along for the first time, but it's a very informal group. Like I said, emphasis on kind of well-being, but people go and make their own flowers, fruit and vegetables that they can take home. So it's just ticking all the boxes for the kind of people that we work with. Yeah, and feel free to send your staff along as well.
Thanks, Susan. Thank you. Ruth, hello.
Yeah, just to update everyone, now we've got the time on food is everyone's business. We have our final testing session where we'll be delivering the training as we have it and making final tweaks to make sure it's as good as we can get it. That is next Wednesday in person at the Vinery Centre, 10 till 12. I'll put the sign up link in the chat. So if anyone does have availability and wants to go, it's all about having conversations about food with people in a positive way and encouraging healthy eating in a way that matters to them, building on a lot of the better conversations principles that the Leeds Health and Care Academy champion so well. Then we'll be looking into how we can roll it out to the whole of Hatch, so we can all be having conversations about food related to our roles in a really positive way in the area. So we're just finishing off our testing phase next week.
Thanks, Ruth. And there are more. There's some places left. So if anybody wants to sign up, yeah, just follow the. I've got a member of staff that's attending, but it's a really great opportunity to be involved early in the training. Cool. Okay, well, let's bring our meeting to a close. Thanks very much. It's been great to see everybody. I'll see you in July.
Thank you very much.
Thank you.
Thanks
Bye.
so much.
Thank you.
Bye
Bye,
now.
everyone.
Thank you, everyone.
Bye.
Bye.
Bye bye.